Hello friends, in this video we will discuss about the remaining portion from spinal cord injury chapter. Okay, so in previous video we were discussing about the active rehabilitation phase of the spinal cord injury chapter. Okay, in that we were discussing about the mat exercise program. So today we will discuss about the remaining portion from that mat exercise program. Okay, so today we will discuss about, first we will discuss about the quadruped position. So this is the position which allow weight bearing through bilateral leg. Okay, so the weight bearing happens through the both the hip joints, and it's allow also facilitation of the initial control of intact muscles around the hip joint and as well as the lower trunks. Okay, so how a spinal cord injury patient can achieve this position? So from prone on elbow position, patient has to walk backward on elbow. Okay, then the patient has to forcibly flex the head and upper trunk while pushing the mat through the bilateral elbow. Okay, and which help in lifting the pelvis area. The pelvis area will get lifted from the mat. Okay, so then after that patient has to walk backward by using the elbow till the hip reach above the knee joint. Okay, so in this way the patient will reach to a quadruped position from prone and prone on elbow position. Okay, so what are the possible exercise can be given in this position? Okay, so first patient has to move in different directions to increase the limit of stability. Okay, then patient has to patient can move both the hand one by one in different direction to uh, okay, to increase the. Okay, then patient has to move one by one hand alternatively to freeing weight from one upper extremity to the other extremity, which gradually improve the balance of the patient in particular this position. Okay, now we will discuss about the kneeling position. So this kneeling position establishes a functional pattern of trunk and pelvic control. Okay, and it's also this position also promotes upright balance control of the trunk. Okay, so how a person can achieve this kneeling position? So the person has to the patient from quadruped position. Okay, the patient has to walk back by using the hand backwardly. Okay, then patient will reach to a sitting position over the heel. Okay, then after sitting on heel, then patient has to climb over the ladder or ladder on the wall or by using therapist shoulder. Okay, while climbing over the wall ladder by using upper extremity, the therapist has to guide the pelvis. Okay, then patient will reach to a kneeling position. So what are the exercise can be given in this position? So firstly, as the patient will be in this position by using bilateral upper extremity, so patient has to reduce the hand support by alternatively moving one hand over the other. Okay, then patient has to try to maintain a position by keeping the hip morely extended and pelvic anterior to the knee joint. Okay, then patient can shift the weight from one side to the other side. Okay, or also in this position patient can practice hip hiking. Hiking. Okay, now now we will discuss about the transfer technique. Okay, so in transfer technique, okay, to start this transverse technique, patient should have adequate sitting balance. Otherwise, it will be difficult for the therapist as well as for the patient to learn this particular technique. Transfer from different surface to different surface is actually taught to the patient. Means first it should be initiated or practiced on a firm surface, then it should be progressed to the alternate surface, like from wheelchair to the bed, or bed to wheelchair, or wheelchair to the bathroom, or toilet to the toilet pan to the wheelchair. Okay, then actually patient. So basically in transport technique, most of the patient they use some variation of lateral scoot transfer. Okay, so most efficient and safest method for patient should be determined. Okay, and there are three important components of transfer skills. These are the momentum, head hip relationships, and muscle substitution. Okay, so momentum can be used by facilitate movement at a joint when the surrounding muscles are weak. Okay, so same way also muscle substitution can be used in this way. Okay, so the other technique is the head hip relationships. Okay, so when patient moves the head in one direction, the buttock will move in the opposite direction. Okay, this is called as head hip relationship. Okay, so now we'll discuss about the gait training. Okay, so basically before gait training, emphasis is given on strengthening use of orthosis and assistive device to learn the compensatory method of walking. Okay, basically the orthotic prescriptions depend upon the level of lesion, and the orthotic prescription for gait training is basically KFO and AFOs. Okay, knee ankle foot orthosis and ankle foot orthosis. So basically the swing through gait pattern is adopted. Okay, so before gait training, patients should learn some strategies. Okay, the first strategy is putting on and removing orthosis. Okay, so the patient is first taught the correct way to don and doff the orthosis. Okay, the entire procedure method of donning and doffing should be taught in supine position. Okay, so and also patient should be taught to inspect the different pressure area on the lower extremity. Okay, then the second strategy is sit to stand activity. Okay, so uh, from sitting to standing activity, okay, patient has to slide to the edge of the wheelchair. Okay, then from there the patient has to lock and unlock the orthosis of the lower limb. Okay, then by using bilateral upper extremities, patient has to pull to a standing position. Okay, once the patient will be able to achieve the standing position from sitting position, then patient has to use the wheelchair push bar, both the armrest, to push himself or herself to a standing position. Okay, once the patient will reach to a standing position, then patient has to tilt the pelvis anteriorly to lock the hip joint in hyperextension position. Okay, then turning around strategy should be practiced. Means patient has to push by using both the extremity. Okay, the patient has to lift up the body and turn around to one side, then again return to the same initial position. Then jackknifing strategy should be practiced. Okay, so this is a very unbalanced positions. So in jackknifing, what happen, the pelvis position, patient has to control the pelvis position by using bilateral upper extremity and position the head and shoulder forward in front of the pelvis. Okay, I have already told that this is a very unstable position, and patient must be taught recovering to overcome and to prevent this from happening during ambulation. Okay, the next strategies is hip hiking. Okay, so patient should be taught the method of hip hiking if the patient will have intact quadratus lumborum muscles. Okay, then advancing the lower limb with strong side flexion and rotation. Okay, the patient should be taught. Okay, so once the patient will reach to a erect standing position, then patient should be taught how to maintain the balance in standing position by using the bilateral lower upper extremity. Okay, by means basically patient has to reduce the support, hand support. Okay, one by one. Then patient has to stand for a long time. Patient has to increase the time of standing. Okay, then once the patient will able to achieve more stability in this standing position, then patient should be asked to walk in parallel bar first by using the bilateral upper extremity on both the side of the parallel bar. Okay, then once the stability patient will get more stability in this parallel bar, then patient should be allowed to walk by using bilateral upper extremity crutch like elbow crutches. Okay, then once the patient will be able to walk with bilateral elbow crutch and bilateral KF force, then patient should be taught how to stand from wheelchair by using crutches, and also stair climbing should be practiced with the patient. Okay, then we'll discuss about the gait training. Okay, so gait training for the incomplete spinal cord injury patient. So basically body weight supported treadmill training is very useful for the gait training of the incomplete spinal cord injury patient. Actually many of the studies shows that by using body weight supported harness and practicing the walking pattern in treadmill increases the quality of walking in many patients. Okay, basically in the incomplete spinal cord injury patient. And one more other method is by using exoskeleton. Exoskeleton is a robotic device which is fitted to the bilateral lower extremity of the patient, which is controlled by a joystick. Okay, the patient, all the weight of the patient is taken care by the exoskeleton devices. Okay, which also training in that exoskeleton also improve the gait pattern of the patient. Okay, so these are the all this means subject in this spinal cord injury chapter. Okay, so we already finished this chapter. Thank you.